The adult skeleton is composed of an axial and an appendicular skeleton. The axial skeleton is located along the long axis of the body, and its function is to support the posture, maintain stability, and to protect the vital organs. The bones are often fused, whilst the appendicular skeleton is located more peripherally and involves the girdles and the limbs. It enables locomotion and digital manipulation of objects. There are various types of bones. There are long bones, short bones, flat bones, and irregular bones. All bones are formed through a process of ossification or osteogenesis. This is a process of bone formation, which can either occur directly from mesenchymal tissue or from an intermediate cartilage model. It starts at 6 to 7 weeks during embryological development. All bone forms from mesenchymal cells, which can take one of two pathways: intramembranous or endochondral ossification. During intramembranous ossification, mesenchymal cells can differentiate to form osteoblasts, which then form trabecular and cortical bone. This forms flat bone, such as those of the skull and face, and as well as the clavicle. Alternatively, endochondral ossification involves multiple stages prior to the development of bone. Initially, mesenchymal cells differentiate to form chondrocytes, which develop into a cartilage model, from which bone will eventually be formed. Chondrocytes undergo hypertrophy and release a matrix which can undergo mineralization, and these chondrocytes then undergo apoptosis. Blood vessels surrounding the cartilage model bring osteoblasts within the center of the model. These osteoblasts form bone and the primary ossification center. The bone cavity and its associated blood vessels form whilst the chondrocytes and cartilage continue to develop at the distal ends. Eventually, after birth, the secondary ossification centers form at the distal ends. The bone forming at the distal and medial portion is separated by an epiphyseal plate or a growth plate, which is a cartilaginous area. The presence of these growth plates allows for longitudinal growth or growth in height. So if there is cartilage to allow for endochondral ossification at the growth plates, the individual will continue to grow. When new cartilage stops forming, endochondral ossification ceases, and the growth plates are considered closed. This typically occurs towards the end of puberty. Eventually, the bone is completely ossified, at which point longitudinal growth stops. This process of endochondral ossification typically forms the long bones, such as the femur and the tibia. Therefore, bone formation can occur through the process of endochondral ossification, where bone is formed from an intermediate cartilage model, or through the process of intramembranous ossification. During endochondral ossification, it is noted that the bone increases in length if the growth plates are still open. The bone also undergoes a process of appositional growth, where it increases in diameter. The outer cortical bone is solid and has an outer periosteal surface and an inner endosteal surface. Bone formation exceeds bone resorption of the periosteal surface, therefore bone increases in diameter with age. Whereas the endosteal surface bone resorption exceeds formation, therefore bone marrow space increases with age. If we look at the following oversimplified bone vector, this region is known as the epiphysis, this is the metaphysis, this is the diaphysis, and this is the growth plate. If the growth plates are still open, longitudinal growth can occur, and appositional growth occurs concurrently. Longitudinal growth continues until the growth plates close. However, appositional growth continues even after growth plate closure, as bone remodeling is an ongoing process. Looking at the following X-ray, note the epiphyseal or growth plate visible here, and none is visible on the X-ray on the right. This tells us that the X-ray on the left is of normal, skeletally immature bone, in other words, of a child, and the one on the right is of mature bone, of an adult. Some clinical conditions related to altered or impaired ossification may include osteogenesis imperfecta, which is a condition characterized by fragile bones. Rickets is a condition related to vitamin D deficiency, causing soft and weak bones, and poor calcification of the growth plate, and patients may present with features of bowed legs, craniotabes, or spinal curvature. Achondroplasia is characterized by abnormal bone formation in utero, causing short stature. Acromegaly, which is a condition characterized by increased bone growth and cartilage degeneration due to increased growth hormone and insulin-like growth factor. And fibrodysplasia ossificans progressiva, which is characterized by extraskeletal bone formation. In other words,